afternoon. Thank you for joining us here on Friday afternoon for an update and some very important news and some exciting news for our small business owners across Mississippi. Before we get to that, though, I do want to begin by continuing to recognize that we are seeing more and more cases across the state, and it is a reminder that this is not over. A flat curve does not mean a community free of transmission. It means we are spreading it out over time. The risk is still very, very real. Even as businesses reopen and people begin to reconnect, we must stay smart. We must stay sharp. Take care of yourselves and take care of your loved ones. Open for business does not mean risk-free. We all need an extra measure of personal responsibility as we move into the summer months. Today, I am extending the executive order that puts stricter health rules in place for certain counties with the greatest risk. It will be in full force and effect at least until June the 8th. We will be amending it. We are going to add Wayne County, which, as we discussed yesterday, is one of the most dangerous parts of the state when it comes to COVID-19 transmission at this moment. If you live in Wayne County, please take greater risk measures to protect your family. It's the reason that Dr. Dobbs was there yesterday talking with those in the community. You are at severe risk of spreading the virus. In addition to that, we will be removing Attala County, Leake County, Scott County, and Newton County. Dr. Dobbs has advised us that many of the measures that we put in place are working in those counties. This is illustrative of our plan. When those counties increase in cases, we want to add restrictive measures. As those restrictive measures work, we want to remove them so that we recognize that this is a fight county by county, not statewide, and therefore the increases in cases are county by county more so than statewide. What happens, for instance, in Wayne County has very little effect of what's going on in Tishomingo County, and we as a state must understand that. Dr. Byers will speak to it in more detail, but these communities have done an excellent job stepping up. They are fighting and they are beating the virus. This order will be extended, however, for Holmes, Jasper, Neshoba, and Lauderdale County as well. So we've had 8. Initially we had 7. We added 1 and went to 8. We are reducing 4 and adding 1 back, so we're back to 5 in total. In addition to fighting this virus, we are also working to quickly get out funds from the CARES Act to our small businesses. We are launching a website today, backtobusinessms.org, which outlines eligibility requirements and paperwork to compile to get access to this grant program. You can see the backtobusinessms.org front screen behind me. That is critically important for our small business owners. Small businesses with less than 50 employees can get up to $25,000 to help offset the cost to their business caused by this pandemic. It has frequently asked questions and information that you might need to ensure that when there is an application to apply, that you're prepared to do so immediately. The team at the Mississippi Development Authority is reviewing the competitive bids to administer these funds. They were due today and should have all the details out by the evening. Then they can put out the application as soon as next week if all goes according to plan. I just want to close by reminding my fellow Mississippians, this deadly disease is real. This deadly disease is contagious, and this deadly disease is in every community across our state. We must stay vigilant. More freedom does not mean less risk, just the opposite. It means that we are trusting you, the people of Mississippi, to do what is right. It means we respect you enough to make your own decisions. But I'm asking you, as a fellow Mississippian, to be wise. Please continue to stay strong. Please continue to stay in the fight. Please continue to be safe. At this time, I will turn it over to Dr. Byers, who will update us from a public health perspective. And as you can see today, I have with me the A-team.
Thank you, Governor. So today we're reporting out 418 new cases. Those are newly reported cases to the Department of Health, and 17 new deaths. 4 of those deaths are from our death certificate reviews that we do, and those deaths occurred earlier in the month between May 11th and May 15th, but it's still evident that we are seeing cases in Mississippi, and we are seeing deaths that are occurring. We are still having ongoing outbreaks in many long-term care settings throughout the state. This is particularly worrisome because we continue to see a higher proportion of deaths among long-term care residents. We're looking at about 50% of our total deaths in the state are among residents who are in long-term care settings. We know that those types of settings are very vulnerable. When you have any congregate setting, especially with individuals who are at significantly higher risk for those complications and deaths, we do see that, and we may well continue to see that. One of the efforts that we've put into place is testing of all long-term care residents and all long-term care employees. That's been ongoing now for a short time, and we've completed more than 80% of those long-term care settings, with just a few more to go in the coming few days. So that's a big win for us. That helps us establish a baseline of current spread within a long-term care setting, and helps us move forward with additional measures that we can put in place. The governor did mention that we've seen some decreases in those 4 counties, and that they're coming off the list of higher recommendations. I think it's been pretty astounding when you look at the data that those 4 counties have had some drops in their cases, not just stability, but actual decreases in the numbers. I think that that's evidence of how these measures can work. If we're all continue to do those things, wearing a mask, social distancing, those are measures that can be effective in preventing further community transmission. And when you have community transmission, there's always a risk that you'll introduce it into long-term care settings. That's an effective way to prevent that as well. You know, one of the things that we're doing is watching individual counties closely. We know that often the increases in particular counties are due to increased testing. Right now in Mississippi, we've tested more than 160 or close to 160,000 tests total in the state. When you look at our goal of 2% of the population, we're reaching that in the last 4 weeks. In the last 4 weeks, we've averaged somewhere between 17,000 to 20,000 tests occurring in Mississippi. That's an astounding number. And what that shows you is that through our partnerships with hospitals, with commercial labs, and the broader availability of testing throughout the state, that there is testing available. But we do know that when we do additional testing in counties, we often see some increased numbers of cases. So that's an illustration that any of the counties can be particular risk. And so even if you're not a county that's identified as in these higher measures through the governor, it's still important to take those standard precautions that we've talked about across the board for everybody. And that's how we can prevent those counties from bumping up higher.